Good morning, everyone. Giving us a couple of minutes to welcome everyone, seeing that a lot of people are joining us right now. So my name is Diane Moyer. I'm a nutrition advisor for Concern, and I will be one of your hosts for today. So before we go to the matter of thing, just a quick housekeeping. Please introduce yourself in the chat box, and if you have any question, use the Q&A option at the bottom of your screen. Please don't use the chat box to ask questions, use the Q&A question. Un mot pour les francophones et les français. Si vous voulez la traduction en français, vous allez avoir l'option interprétation en bas de votre écran, cliquez dessus et vous aurez l'option français. Sorry, my Spanish is not good enough, but if you need Spanish translation, please use the interpretation option at the bottom of your screen, and you should have translation in Spanish and also in Arabic. Don't hesitate to ask questions, and thank you again for joining us today. Next slide. Next. Okay, so today, this webinar is on an overview of software tools for calculating food and assistance and cash and voucher transfer value. So this webinar will be about 90 minutes. We have a lot to cover. We are really looking forward to your question, and we apologize if we have no time to cover all of them, and we'll do our best. Next, please. So this webinar is being led by a few experts, as you can see on the logo on the screen, under the umbrella of the Global Technical Working Group, CVA for Nutrition. This global group has been created, this Global Technical Working Group has been created a couple of years ago with the purpose to promote sharing of good practices on CVA for nutrition outcome, but also to identify the key technical gaps and to address them. So amongst the gaps that were identified, there was one on how to calculate CVA when looking at nutrition outcome. Next slide, please. So what come out is most of the time practitioners have highlighted that they don't know how to estimate the proper amount when you want to estimate how much does it cost to have an appropriate diet, what the cost of food and nutrient requirement for of emergency affected population, and how do we convert this need into a cash transfer equivalent. So this has been a challenge that has been frequently highlighted amongst practitioners. So as you may know, for the one that have already been using cash for nutrition or just cash, there are different software tools, but sometimes you may not know which one is the best or even how to use it. So that's why we wanted to start this series of webinar to try to highlight a couple of tools, explain how it's working, what you can get out of each tools. Next. So this series of webinar will be in 3 parts. The first part is today, which will be a quick overview of current practices, challenge, and available tools. So it's not a full training on cost of diets. This will take at least 5 days, but it's more like an appetizer, something to make you want to know more about cost of diets and NUTVAL. If, and we hope you will, are more interested in the cost of diet, there will be an overview for user on 16th of November, and there will be another webinar dedicated to NUTVAL, probably around November 27th, around Thanksgiving for our American colleagues. Next. So what do we cover today? As I say, our agenda is quite packed, so be patient with us. So here you have the introduction. Then there will be an overview of the current practices and challenge facing practitioners. So this will be presented by our colleague Damien and Marina, which I will introduce shortly. Then a presentation of comparisons of tools by Masoud and Andrew. There will be a quick poll to try to understand better what is your level of knowledge on using cost of diet and NUTVAL and other tools. We will be lucky enough to hear from a case study from Malawi and from Nigeria, and we will finish, as is usually the case, with a discussion and some Q&A. Next. So who are we hearing today? So I already introduced myself. I would like to introduce also Marina Tripaldi, who's a CVA advisor for Save the Children, but also the co-lead as myself of the Global Technical Working Group on CVA for Nutrition. We also hear Damien Jou, who is a program officer for the Global Food Security Cluster, Maggie, who is a nutrition advisor for USAID, Andrew, who is an associate professor from UCL, and finally Masoud, who is a nutrition advisor for Save the Children. Next. And with our transition, I would like to hand it over now to Marina and Damien for the first session on designing CVA transfer value for nutrition adequacy, current practices and challenges. Damien and Marina, it's you.
Thank you, Diana. Next slide, please. So, as Diana announced, my name is Marina Tripaldi. I'm the other co-chair of the Cash and Voucher Working Group that sits under the Global Nutrition Cluster. And I would like to remind you today that the work of the group on this thematic area is really based on a key document that is used as a reference for us on the different steps of how to use CVA for nutrition outcome. This document is the evidence and guidance note that was published in 2020, really by the GNC in collaboration with all its members, and that was based on evidence review on projects that were using CVA for nutrition across the different regions, and also based on feedback from practitioners and experts. The evidence and guidance note includes a section on how to design CVA transfer value in projects that are aiming at having nutrition outcomes. The chapter is very rich. We won't cover everything today, but I wanted to highlight some key considerations that are proposed by the evidence and guidance note on how to design the transfer value. So the first one is really the way to design it. It really varies according to the objective of the CVA for nutrition component. The first one that is proposed in this table, extracted from the evidence and guidance note, is the objective of accessing when CVA is used to access a nutritious diet. So in this case, very often practitioners design the cash or voucher transfer value based on households' needs, but they can also design the transfer value to cover the needs of the individuals for most of the time for individual feeding assistance. What is the content of the expenditure basket in this case? So how do we calculate this transfer value? When we want to improve the nutritional adequacy, when we want to make sure that our beneficiaries have access to a nutritious diet, we want to consider a food basket that is meeting the nutritional requirement of these individuals, or the gap of the cost of this nutritious diet and what they can meet with their own means. And the transfer value can also be a combination. Actually, the evidence and guidance notes really recommend to provide an assistance that take in consideration the needs of both the households and individuals. The note val and the cost of the diet are the tools that can be used to make this transfer value nutritionally adequate. The second type of objective that is proposed is when cash or voucher assistance are used to cover a series of basic needs to access to different goods and services. But that should include, of course, also a nutritious diet. Most of the time when CVA is designed for this purpose is based on an household's target group, an household's transfer value. And as we know, in a humanitarian crisis, people very often, they face multiple needs. So the way this transfer value is calculated should take in consideration a minimum food basket that is meeting this nutritional requirement exactly, as we see in the first objective. And these individuals are the individuals at risk, pregnant and breastfeeding women and children under 2 or children under 5, but can also include non-food expenditures that are extremely relevant to nutrition, like health, water, hygiene, sanitation. Very often we see that costs related to transportation are instrumental to access to the market or to access to health and other basic services. In this case, the methods that most of the time is used is the minimum expenditure basket. Yeah, that is really an available method to design a multi-sectoral transfer value. Next slide, please. So what are the practitioners doing? Most of the time, the practitioners design this transfer value mainly considering what we call an energy-based diet, a diet that look at the macronutrient, and very often that is not taking in consideration these micronutrients that are required for pregnant and breastfeeding women, which need more iron, more vitamin, and other specific micronutrients. And similar, the children under 2 or children under 5, according to what's the target group for wasting. So the nutrient cost of the diet can help to make this transfer value more nutrition sensitive. And as I said before, again, when we look at multiple needs, the recommendation is really to have a transfer value that is as holistic as possible to cover most of the needs, but at least we encourage to include costs related to hygiene, health, and transportation. So there are many other practices and challenges. I would like to hand over now to Damien, that is going to talk us about some of these feedback that have been recorded by the food cluster and that are recurrent challenges and practices. Damien, over to you.
Okay, thank you, Marla. Okay, so the way the food security cluster at country level designed the MB, the minimum expenditure, it's usually done following 3 approach. And this will help you to understand why we have some issues there. So the first one is the right-based approach. The second one is the expenditure base, and then the mixed approach that doesn't need to be too much detail because it's a combination of the first 2 approach. So if we consider the right-based approach, which is something that we can call also the energy-based diet, it's usually the most used approach by the food security cluster, and it's focused on the 2,100 kilocalories per person per day. And usually we take into consideration the percentage of energy from fat and protein. But for the food security cluster, when we do food assistance, we target households. We understand that we should sometimes disaggregate at household members, but we don't have specific targetings. What we do in some countries, for example, like in Nigeria, is that we have package based on the household size. So if it's a family of 1 to 3, 4 to 5, 4 to 6, 6 to 8, and over 8, but we don't go beyond this kind of targeting. We do sometimes also targeting based on the IPC classification, if it's IPC3, IPC4, sometime on regional, sometime on emergency. If it's pure emergency, so just after a disaster, we have a 3 months package, and then after, let's say, a longer term package. But we don't do addition other targeting. So what Marina mentioned, so we all the population at risk, the individual at risk, like the pregnant lactating women or the children under 5, we don't focus specifically on them. What we do also is sometimes we look at the standard food ration, and often it's the WFP food ration that we take into consideration. Or also what we do is to look at the most consumed food in a specific region. Because we are doing also a mapping of all the food basket, the transfer value, we can see that there's a good use of NUTVAL. Of course, we focus more on the kilocalorie. So we on usually this package, the definition of the design of the package or the MEB, we have a good participation from nutrition colleagues. It can be someone from the nutrition cluster or from a nutritionist, for example, WFP or an NGO. But what we have seen also is that sometimes the last fair standard is not really put into practice. So that's kind of an issue here too. Next slide. So the other way that we do also the design of MEB is based on expenditure-based approach. So I don't know if you are very familiar, and I'm sure if you work with Save the Children or other organization, they use it a lot as they developed it. So the aim is to look at how much people spend on food, and usually we look at the poor wealth group. So let's say the poorer people, the most vulnerable. Again, we focus only on household. But what we have seen, there are two issues first. So the first one is that often their diet is not very nutritious. I can take the example of Bangladesh, where the composition of their meal is really heavy on rice. So there's a lot of cereal, and there's limited protein or vitamins or minerals. What we have seen also, that's another issue more for the food security cluster, is that it's usually we do this kind of analysis during let's say the quiet time, or not when we have an emergency. So it's not really adequate with the state of the response. Something that so when we have this MEB, then we calculate the transfer value for the food assistance. Sometimes it's the same. So if we consider that the family, the household don't have too much coping to provide their own food, then we'll consider that this is the same. If not, then if they have a capacity, then we'll remove a portion of it. What I would like to say, yeah, so usually the food assistance is covering about 60 to 70% of the total MEB. There's a few countries that have a survival MEB, what we call the SMEB, but it's a very few country. I think that's the last next slide. So just to wrap up on the issues that we face is that the transfer value is always influenced by the staff capacity. For example, there's good capacity regarding NUTVAL, but very much less on cost of diet. It's something that we don't have capacity with the food security cluster. There's of course competing methodology on donor priorities on budget. We usually work well with the cash working group on the nutrition cluster, but not together. So we link bilaterally, but we don't work together on the MEB, on something that we need clearly to improve. As I mentioned, as Marina mentioned, also we don't look at individual risk. So this is something that we need to increase on the And finally, yeah, we need to use more NUTVAL on cost of diet to improve the nutritional adequacy. That's all for me.
Thank you very much, Damien and Marina, for this first introduction to the current challenge faced by practitioners on understanding the different MEB and how it's being calculated. And now we are going to listen to Andrew and Masoud telling us about comparison of software tools. Guys, that's for you.
Thanks very much. Great to be here and have a chance to present to you some comparison of those two particular software tools that have been mentioned. Next slide, please. So just wanted to also point out there that not the only ones that are out there. So I'm not sure how many of us would remember NutCalc. I just about do. It was an Action Against Hunger ACF tool, probably no longer used as far as we know. And then we have the two that we're talking about today, NutVal and Cost of Diet. But there are others, of course. So for example, Optimus and Enhance being developed by WFP, more for in-house use. And there's also, of course, commercial nutrition software and online databases, which are probably used by practitioners at certain times. And then other agencies and individuals will also have designed their own spreadsheets for doing their own calculations as well. So there's a range of different software tools out there which can help us with the challenge of looking at the appropriate transfer value in a CVA nutrition program. Next, please. So we're going to focus on those two for the following reasons today. Both tools are available at no direct cost to the user, but there are, of course, costs involved in training and support, but there's no direct cost to use either of those software tools. Both of them can be used in different ways to help in the process. Both of them were mentioned and recommended by the evidence and guidance note, and they've both also been used widely by many different agencies and in many different contexts. The other tools that were mentioned in the slide above, such as Optimus and Enhance, are very much specific to certain agencies, in this case WFP, and therefore maybe not as widely available to all of us here on the call as these other tools are. Next, please. So in brief, here is a comparison of the two tools. And it's great that we also have Masoud on the call today. He's an expert on the cost of diet and will be able to deal with any questions that may be coming his way on that piece of software. So cost of diet is a software tool, but it's also a methodology for assessment. And it includes within the software a food composition table and a human nutrient requirement database, and can be freely downloaded from the web link provided there. And there's a practitioner's guide also available at the smaller link below. In a similar way, NutVal also contains a database of nutrients and foods, although it's more limited than the cost of diet, and specifically focuses more on foods likely to be used in a humanitarian program. Both tools are actually currently only available in English, but there are training tools or training materials available in French for NutVal. Next slide, please. So the cost of the diet was designed with the aim to help estimate the lowest cost, the quantity and variety of local foods that are needed to provide a typical family or individual with foods that meet their nutritional needs, focusing both on macro and micronutrients. In a similar way, NutVal was designed to also do that job, but in a more simple way. It was designed to make the job of particularly nutrition managers, nutritionists, and health staff easier, and focusing very much just on the foods available in typical humanitarian response programs. And it also uses nutrient requirements, which were calculated and included in the CVA standards. So it has a particular focus on the humanitarian sector and is a simpler tool and less thorough in its approach than cost of diet. Also, cost of diet, really importantly, is a program which can automatically optimize a diet design to give you the answer to what is the lowest cost at which nutritional requirements can be met in a given context. So they are useful tools, but with slightly different purposes. Next, please. So in terms of the functions, cost of the diets can be used to conduct formative research, help in the design of SPCC materials. And what we're focusing on today, of course, is the design of CVA transfer values. It can be used also to help in program evaluation and to identify and promote low-cost nutritious diets specific to your local context. NUTVAL, on the other hand, can be used to, as I mentioned before, focusing on the most common foods available in humanitarian assistance. It can help provide information on the nutrient content of those, can calculate the nutrient content of a food assistance ration. You can use it to compare different rations and assist with on-site distribution monitoring. Next, please. So how is it being used, or how have both of these tools been used? So the cost of diet has been applied in over 40 countries by 29 plus organizations in both humanitarian and very much in development contexts as well. And it's been used to promote affordable and nutritious diets, inform social protection programs, and inform national and subnational advocacy initiatives. NUTVAL, on the other hand, has been applied in many operational humanitarian contexts, particularly by organizations such as WFP, UNHCR, ICRC, and many NGOs. It was originally focused very much on refugee contents, and in terms of the history, it was actually originally designed or put into traction by Rita Bhatia, who was the nutritionist at UNHCR at that time, several decades ago. But since its early origins, it's now being used in quite a wide variety of different humanitarian contexts. Next, please. Important point is that both of these tools require additional information if we're going to use them to calculate the transfer value for a CVA program. While they both have databases, we may not necessarily know which food items are available locally and which food items are available locally in a particular season. So we are likely to have to look for additional food information. And of course, focusing on CVA is critical to get good price data and also to get some indication of what we can expect to happen to those prices over the period that the program is being designed for. So what sort of inflation are we likely to expect in those food prices? We also are probably going to be concerned about particular population subgroups, such as pregnant breastfeeding women, elderly, young children, and we would need to look at what food items are going to be useful for them. And then we're going to have to also perhaps look for information on food sources for the particularly focused groups, which often are poor and very poor. And also to get information on income, if we're going to be able to look at the affordability gap. Next slide, please. So finally, just a brief sort of side-by-side comparison of those two software tools. So the food database is definitely more comprehensive in cost of diet. And cost of diet also allows mathematical optimization of national and local diets, which isn't really available in NUTVAL at the moment. They can both be used to help in the calculation of MEB, but of course by themselves wouldn't be necessarily be adequate to do that in all situations. They can, or NUTVAL is a bit better probably for planning food distributions, and both have a role in planning for CVA programs. In terms of the ease and speed of use, people generally report that NUTVAL is relatively easier to use and requires less training and support. Unfortunately, as I mentioned before, they're currently only available in English. Both are available online and both are freeware. And good news is that both are actually planning for new versions. So in the upcoming seminars, or perhaps later today, it'd be great to get more input from participants about what features would be most useful to help them in their work in terms of calculating transfer values. Next slide, please. And now I'm going to hand back, I think, to Diane for the poll.
Thank you very much for this comparison. Before we move to the case study, I hand it over to Marina for the poll and for Sanya for the organization. Marina, you with us?
Thank you. Thank you. So we would like to hear from you now, and we would like to ask you what is your experience with these tools. Which of the following methods, tools have you used to design a CVA for nutrition transfer value? Which of the following are you familiar with? You can select all that applies. So if you've used the three of them, you can select the three of them. Otherwise, just please select the one that you have experience with, or that you think you have a good level of understanding. So you should be able to see the question launched as a poll question, and you should be able to vote. Maybe we give a minute or so to see what comes as a result. And the idea of this question is really to try to understand what's the level of use and what's the level of knowledge for each of these methods and tools. We are going to have a Q&A session at the end, but we would encourage you to think about what you would like to learn more about each of these tools for the upcoming webinars that we'll be hosting. Sandra, are you able to share with us the results of the poll? You can close it now. Okay, so most of the audience today seems to be more familiar with the minimum expenditure basket, which is followed by the NUTVAL and cost of the diet, which is really understandable, considering that, as we presented at the beginning, most of the practitioners have used the minimum expenditure basket so far to design transfer value. So we probably going to do a good job in organizing this orientation on these two other tools that we would like to encourage you to use to make the transfer value more nutrition sensitive. I think we are going to hand over now to the case studies. Over to you, Diana.
Thank you very much, and very, very good to hear that people are already familiar with the different tool and the MEB approach. Thank you also for all your questions. Don't hesitate to keep asking questions. For the French speaker, if you want to ask them in French, you can also write them in French. We can answer in French, don't worry. And now we will listen to Masoud sharing experience of case study, experience on the use of cost of diet software in Malawi. Masoud, it's you.
Thank you, Diane. Hey, everyone. For those who have joined a bit late, my name is Masoud Rana. I work for Save the Children as one of the global nutrition advisors. And part of my job is to promote and help people use cost of the diet for various different nutrition programming, evaluations, and research. Today, we of course are going to only focus on one specific use of this software, which is how do we define the transfer value for a CVA program? And you can also say the same for a social protection program, right? So that's the use case. Can you go to the next slide, please? So in this case study, what we are going to talk about is specifically how we define the transfer values. But as many of us know, that coming up with a transfer value is not the only thing that we do in a program. There is a lot of negotiation you have to do with the donors. You have to set up the systems, and those are all same for any CVA programs, right? So right now, I'm just going to focus on how we use this specific tool for defining the transfer value. And I'm going to show you an example from Malawi. And many of you already know about Malawi is one of the poorest countries in the world, where like 70% of the people live below the international poverty line, right? And then it's no surprise that, more than 1 out of 3 children is stunted and malnourished there. So that's the context. And if we go to the next slide, then you'll also see the poverty percentage, and you might wonder that, wow, we thought like 70% of the people are living below the poverty line. But you have to remember that was the international poverty line. But the Malawian government, they came up with a national poverty line, which is a bit lower than the international poverty line. So far, I remember it was roughly around 61 cents per person per day is the national poverty line. And even with that tiny amount of money, not many people have that level of income, right? So you can see more than half of the people nationally are living below the poverty line, and 1 out of every 5 people in Malawi is living below the extreme poverty line, or you can say like the food poverty line. They don't have enough money to buy enough food for themselves. So that's a bit of a context. And before I go into the example, I'm also gonna share like another contextual setting so that you can understand where we did that cost of the diet analysis to come up with the transfer value. Next slide, please. So our whole study was part of this program. We call it the Mazika program. And understandably, the program's objective was to, of course, reduce malnutrition among children, specifically children under 2. And a couple of other objectives the project had is to generate evidence around cash transfer and the impact of cash transfer on nutritional outcomes. And not only generate this evidence, we wanted to use this evidence to inform the policy discussions. And the policy discussions would be surrounded or would be around the topic that whether we are giving people enough amount of cash to meet all their nutritional needs. When you do that, whether it has desired impact. So that's sort of the background you can think about where the Mazika program was coming up. And it's a new program. We have just launched this program literally at the end of last year. And this year we have came up with the transfer value, and we started distributing the cash. So that's the broader context for this study. Can you go to the next slide, please? So at the beginning of the project, we started looking at the rising food prices. In Malawi, we saw the food prices were going up, skyrocketing. I mean, you have the context, of course, right? There was the Ukraine war. There was, of course, then the COVID, the post-COVID era, and the inflation was high, and different food prices were going up. But the way we wanted to see is when we're transferring a value, we wanted to ensure that the amount we are providing is sufficient for people to meet their nutritional need, what they couldn't do with their existing level of income. So essentially, we wanted to try and see what they can afford with their existing income, and we're gonna fill in that affordability gap. So we had a food list. So there are 2 ways we could go with it. So one is conduct a typical cost of the diet analysis, which is a thorough study looking at all the available food items and collect this data. And this would be time consuming and also a little bit expensive. So in this case, we went for a unique approach, use the secondary data and use the food price data that the World Food Program in Malawi was collecting as part of their MEB analysis, minimum expenditure basket. So we took the food prices from there and then went ahead and conducted this study. And in the next slide, you'll see an example. Can you go to the next slide, please? Yeah. So a typical cost of the diet, what you do, like you already heard, it comes up with a nutritious diet that's possible at the lowest possible cost, right? So whenever we wanted to estimate this diet and the cost of this diet, we can do it for a whole family. We can also do it for a specific individual, however we want. The result is, I know the slide has like a lot of tiny dots, so don't worry, you don't need to look at this thing. I'm just giving you an example what a typical diet looks like. So we went ahead and calculated the diet that meets all the nutrient requirement that includes like carbohydrate, fat, protein, and different micronutrients that includes like vitamins and minerals, right? For all the family members. So the standard family size for Malawi is 5. We calculated this thing for a standard family in Malawi. Next slide, please. So now that we got the quantity and the cost, we tried to see how much was the nutritious diet costing in each of these months. So we had the study running for a whole year, starting from April 2021 and March 2022. Of course, it is a retrospective look. We wanted to see how the whole thing has changed, and we see like it's around like 25% increase in the cost of a nutritious diet. And when I say cost of a nutritious diet, I specifically mean it's a nutritious diet that's also desirable nutritious diet. And that's pretty high. And you see like, you know, it's trending up. Of course, it gives us an annual figure. I haven't presented here, but the annual cost of this diet would have been more than $1,200. To be specific, it's $1,236. And I think at the very beginning, Marina was talking about the cost of meeting energy alone and the cost of meeting all the nutrients. So if you're thinking about cost of meeting energy alone, or even like energy, protein, and fat, the lowest possible cost would have been something around $335. So you can see if we want to meet the nutritional requirements, the cost would be way higher. And if we calculate a transfer value, just thinking about meeting the energy, protein, and fat needs, that's probably not going to have like the level of impact we want from our cash transfer program. And even for a program where we cannot provide all the cash that that family need, at least we should know how much a family would need to meet all of their nutritional requirements. So we have this cost of the diet for the whole family. And from there, we also have their income from a different source, and we can compare whether this is affordable by people. So how do we do the affordability analysis? Next slide, please. So in the affordability analysis, we just don't think about the food cost alone, because people have other non-food expenditures that's essential: medical bills, school fees, electricity bill, fuel cost, right? So people have to use those cash. People have to use those things and spend money from their cash income, right? So when we are calculating affordability and cost of the diet, we consider both food and non-food expenditure. And only when we see that the existing income can cover both the food cost that the software gives, and the essential non-food expenditure. The key thing here to remember is essential. I'm not talking about luxury item, essential non-food expenditure. Then we can say this diet is affordable by people. So let's look at the affordability for the whole household in the next slide. So this is a simplified presentation. I didn't make it complex. You can see we are focusing here for two different groups. On the left-hand side, we have the poor population, and the very right-hand side is like the very poor, the extreme poor population. So for the poor population, their requirement, food cost and non-food cost combined, was $1,629, and their annual income was like $1,000. So that's sort of like a monthly gap of like, you know, $51 or something. And for very poor people, the monthly gap was something around $71. So what do we do with these things? We know the affordability gap. Could we transfer this amount of money to all of the households? And there comes the conversation within the program, within the donors. So can I go to the next slide? So that's something you're all familiar. Doesn't matter however you come up with the transfer value. This is the conversation you have to have within a CVA focused program, right? We have to see like, you know, what is the need? And then you think about what's the elasticity of cash, what would be the negative impact of like large cash transfer versus like the amount of cash transfer you do, whether it's going to cause any social conflict, but also what other benefits your program are providing. We are, of course, providing some sort of food security intervention, home food production, right? So you have to think like what other things you're providing, and then agree on a value that's applicable and that's also accepted by different stakeholders. So that's the tricky part, and that's something beyond the scope of this presentation. But I think, you know, working in the humanitarian sector, all of us have to go through the same level of conversation, irrespective of the tool we use, right? So we decided that the program cannot really cover all the household affordability gap. It's specifically focusing on mother and children. And if we are going to go for like the government advocacy, we need to look at individual affordability gap, because we are going to give the cash transfer to mother child care, like pregnant breastfeeding mothers and children under 2. So basically looking at the first 1,000 days of life. So we went back to the drawing board and say like, all right, what's the affordability gap for an individual, or at least like during the first 1,000 days of life? If we go to the next slide, we'll see that we have done the same calculation we did for the household, but here we did for the individuals. By individual, I mean the mother-child care. And here we see for mother-child care, for 30-month periods, by 30 months, it's like the first 1,000 days, right? And within the first 1,000 days, you cannot really count that much of the pregnancy, because we're thinking about the programmatic cycle. So you have to think about the 30 months period, like 6 months during pregnancy and 2 years after childbirth. So that's in total 30 months. So in that period, for a poor mother and child care, the total affordability gap was something around $426. That turns out to be roughly a bit more than $16 per month per mother child care. And for very poor household, it was or not household, very poor mother and child care, it's more about $20 or something. So there we got our recommendation from the research team that this is something we recommend. We of course recommend to cover like $20 so that everyone, even the very poor household, get all of their affordability needs covered. But of course, that's something couldn't do. At least the program team and the donors couldn't do. So they came up with a number. Can you go to the next slide, please? So they agreed at the end to use the dollar value roughly around, and also the next slide. So this is something we already covered. So they came up with a number of dollar value, which is $17 per month. And we were very pleased to see that they are using the recommendation. In very rare cases, doesn't matter which software tool you come up with, in very rare cases, whatever you recommend based on your research is accepted. It wasn't an easy conversation, but also I have to admit that we had donors who wanted to see what we can do with like the full filling the gaps, right? We transfer the full amount to the mothers, but also recognizing the fact the program will be running for quite a few years, and the food prices, the way it's rising, it's going to probably rise even more. So the $17 per month, if we cut it down, it's going to be even less, even mean little down the line in like 2 or 3 years. So they came up with this transfer value, but this is, as I said at the beginning of this presentation, that this is also a research program. So they have come up with other different transfer values, 43 and stuff. And they try to see like, what transfer values, like, they try to cover some of the household level affordability gaps. And they have like different arm in the study and see like which one works the best. So this is an ongoing project, but that's how we come up with a transfer value of a CVA program using cost of the diet tool. Thank you very much. Next, please. And now, do I hand it over to you, Diane?
Thank you very much, Masoud, for this really great presentation on what you did, what your team and your colleague did in Malawi. And now we will be hearing from Maggie on how Nutval was used in Nigeria. Maggie, are you with us?
Yes, I'm here. Thank you, Diane.
Thank you.
So I wanted to share with all of you today an example of how we use Nutval in our guideline development process around a year ago in Nigeria. As many of you may know, Nigeria has been in a conflict for many years now. And the northeastern part of Nigeria has a very high population of internally displaced people. Many of them are living in urban and peri-urban areas. And so there's been intensive use of cash and voucher approaches for general food, household level food assistance in that context. And because of nutrition gaps and needs, there has been a large amount of innovation from the community of practitioners in that space to try out different kinds of vouchering and cash approaches for nutrition. And so we came together last year, realizing that those approaches were definitely innovative and unique, but not harmonized across partners, and that there wasn't any specific standard that was being used for the transfer value or the justification of that. And we decided to work on a set of guidelines. And so you can go ahead and go to the next slide, please. So what we were really looking at in this context is specifically, as Marina noted at the beginning of the presentation, how do we calculate the transfer value for a transfer that's looking at diet adequacy to meet the gaps that are there from the household food assistance? And so because we know that household food level assistance often, and certainly in the case of Nigeria, is calculated based on trying to meet kilocalories, but not focused on micronutrients. And then also that daily kilocalorie and micronutrient requirement in the SPHERE standard isn't calibrated for the unique needs of pregnant and lactating women or small children for their growth patterns. We knew that we needed to be able to really look at the nutrition values of what was being presumed to be purchased with a transfer value to make sure that it was powered appropriately. So what we needed to justify the transfer for diet adequacy was a clear understanding of what the nutritional coverage was of the transfer value and what were the inherent assumptions. So when we came into the space, there were a lot of black boxes. Fundamentally, many of the implementers were just sort of guessing at a value. At one point, one person said, "Yeah, we just made it up." They didn't have any rationale or approach for saying we want to give 8,000 naira a month or 10,000 naira a month. There was no reason for it. It was just sort of contrived. And so we needed to detail very clearly what was the calculation methodology for getting to that result. The second thing that we needed to do is we needed, in this context, it may be a little different than the context Masood was talking about for Malawi. The people receiving these nutrition transfers are also receiving household food assistance transfers. And so anything that they receive will inherently and necessarily be related to what they're receiving in the GFA. It's not a standalone program. And so there's that inherent relationship. And we needed to be able to calculate that relationship based on what was in the GFA food basket, the illustrative food basket that was included in the MEB. So we needed a tool and calculation method that would provide the ability to re-justify the transfer values in the future. So it's not a single implementer that's doing these transfers. It's a group of implementers, some INGOs, some local NGOs, some civil society organizations, and some UN agencies. And they all needed to be on the same page about what the transfer value was and how it should be calculated, because as you all know, in humanitarian circumstances, the MEB coverage may change. Right now, it may be 70% coverage of what the MEB is. And then because of shifts in the funding environment, it might go down to 50% coverage. And so then what is needed in the nutrition basket is related to what's actually covered in the general food assistance. So the recalculation at regular intervals is a really important part of the process for the nutrition and food security cluster to do together. And so that the tool that's used and the approach that's used needed to be transparent to everyone and recalculable. Having a big process that takes years or months to complete isn't a reasonable approach for an emergency environment where you need rapid and frequent recalculations. And then the final point here that I would really underscore is that, and some of you have asked some questions about this in the question and answer already, the equation and the rationale for the calculation is at least, if not more important than the actual transfer value. because location and price variability, they change a lot in the GFA or in the MEB. And so it's really, really important to know how you are calculating it, rather than, like, the end goal wasn't to say this amount of money is going to be the transfer value. The end goal was to develop a calculation rubric so that in city A, I can calculate what the market prices are and what the transfer value should be here versus in the next state in city B. Because there's a lot of variability for rural and urban settings and across cities in this context. Next slide, please. So the reason that we chose to use NutVal, there were a few reasons. First of all, as Andy highlighted earlier, it's an open source software which anybody can download for free onto their laptop. It works offline. You don't have to be connected to the internet to use it. And anyone at any point can test my work. So if I come into a meeting and I say, this is what our transfer value should be, this is what should be in the basket, because that's meeting the nutritional gaps, any of you right now, you could download this tool and you could check my work. So it's very transparent and it enables regular recalculations. It also provides a very nice visual of the nutritional values of the different foods in the basket. So you can visualize the actual coverage of what is in, you can build your GFA food basket in there and see what it covers and what it doesn't, and then add foods to it to meet those nutrient gaps. We also were able to do this in a workshop setting where we had a range of experts. We had global technical experts who came into the conversation. I was there, Marina was there. We also had field experts who were actually working in Northeast Nigeria who came in and could comment with a lot of expertise about what local diets look like, what's actually available in the markets, what's available seasonally. We did a seasonal calendar for different kinds of nutritious foods for the Northeast. And that really helped to sort of round out the entire conversation about what options we had for nutritious foods. Now, this is an interesting aspect of this. We actually piggybacked on a recent cost of the diet analysis that had been done as a part of WFP's Fill the Nutrient Gap approach. They did that analysis for the entire country. But as a part of that, we were able to receive local foods lists and pricing from the cost of the diet that we then used for our exercise. So we sort of shopped from these, what we call a sentinel food list that we made from the cost of the diet. And I'll show that to you in a few minutes, what that looks like. And for me, the really important part of this process of using an open source tool and working together off of a list of sentinel foods is that it's a consensus building tool. I can sit alone at my desk and make a basket, but when you need to make a basket together as a group, it really matters when you can look at the software and see that, you know, the vitamin C or the vitamin A content shifting with the foods that you're adding to the basket. And it makes it a very literal conversation that it is really important for reaching consensus as a group, which, as you all know, is a fundamental component of a healthy coordination mechanism. Next slide, please. So the purpose of our exercise in Nigeria was this. We needed to develop and cost a reasonable set of complementary fresh food baskets to address nutrients that are not represented in GFA transfers for pregnant and lactating women and children under 5 with the seasonality consideration. Next slide, please. So one of some of the caveats that we considered when we were building this basket is that similarly with designing a minimum expenditure basket, the contents of the basket are illustrative. They're not being, the contents of the basket that determines the transfer value don't presume to say that that is what people will actually buy. They should be reasonable and they should be low cost, but we know that the beauty and the value of cash and voucher transfers is that it provides autonomy to program participants by giving them choice. And so we know that just what we build in the basket, even though it might be something that I put together as an ideal, as a nutritionist, that seems reasonable for a local diet, it doesn't necessarily mean that people will actually purchase those items. And so there's going to be some variability there in what they purchase. We ensured that our design held all else equal. We assumed that we're not going to be able to measure leakage. And so we didn't do like a bonus or a bump out for either of the groups of concern, because it's tricky, like understanding that the foods will come into the house and other people will probably share the foods, but sharing or leakage is really tricky to measure. And we also presumed that the MEB for the general food assistance was not going to be recalculated. So we did it based on the actual transfer amount of the MEB at that time. And we put a caveat into the guidelines that the transfer values for nutrition and the coverage could be recalculated at regular intervals as the guidelines are updated as the cluster sees fit. We also knew going into this that because of challenging funding environments and also because of the way that MEBs are designed, focusing on calories rather than micronutrients, that these transfers, the nutrition transfers, would likely be outsized in their cost because the food security transfers are underpowered fundamentally for nutrition. And so our approach going in was that it's very important to know what's the cost for actually meeting the gap. And then after that, we would have a conversation about willingness to pay. What I've found in many scenarios is that we come into the conversation with a perception about what the donor is willing to pay, or whether or not the amount of the transfer would be really, really large and would cause community challenges. And so I'm a math first person. So I think it's very important to first know what you're dealing with. And then after that rationale and calculation metric is established for what the actual gaps are, then the conversation can go to affordability. What is the donor funding environment? How many resources are available? And maybe you say, just like with an MEB, we're able to cover 50% of the cost of this. But we expected going in that it was going to be quite expensive to cover the nutritional gaps. And then the final point here is that we used Sentinel Foods to represent key food categories and we used foods that were available for longer periods in terms of the season. So we didn't, for example, have the full list of all of the dark green leafy vegetables that are available in Northeast Nigeria. There are lots of them. There were like 3 or 4 key ones that we used as Sentinel ones to create the baseline. And so then we can go to the next slide, please. So this shows you the list of Sentinel foods that we used. Again, this was from the Fill the Nutrient Gap Cost of the Diet exercise that was done for the whole country. We pulled out ones that were unique to the Northeast. And then we used these with the prices per 100 grams and had the groups do their calculations of their baskets using this shopping list, so to speak. Yes, and so basically we loaded the NutVal onto everyone's computers, and we had each group build a basket and then have those the rubric of those baskets included now in the Northeast Nigeria guidelines, and they are being used. The cluster decided to use these for a lean season approach in Nigeria, and so many implementers now are doing a 5 or 6 month approach using the basket calculation. And again, I'm not showing you the actual value of the basket here because implementers are calculating the value in their own location based on the foods that are in those baskets. So I think this is my last slide, and I will hand it back to Deanne for the question and answer session. Thank you so much.
Thank you very much, Maggie. And I see a lot of questions popping up. Just don't forget to put the question on the Q&A and not in the chat box. Otherwise, we might not see them. And we also see a couple of hand raised. We will also give you an opportunity to talk. Just handing over to Marina for the conclusion, and then we will move to the Q&A. Thank you very much. Marina?
Thank you, Diana. So he had so much content to cover today, and it's hard to summarize the conclusions really on all the key points that came up from those presentations. There are definitely a lot of considerations on similarities between the NUTVAL and the cost of the diets that I would like you to read more in details when you receive the PowerPoint on the slides that Andy presented. But one key point that we wanted to highlight, those are softwares. Those are tools that you can use to improve the nutritional adequacy of your transfer value. But keep in mind that you will always need information on availability of nutritious food in the target location where you want to intervene, on preferences of this nutritious food from the individuals at risk, the pregnant and breastfeeding women, the children under 2, the children under 5, and also on the prices, on the affordability of these nutritious food items and the seasonal effects. It's very important that we associate all these analyses for good use of these softwares. And again, there are many differences you've seen on the purpose, on the functionalities, but one difference that we would like to highlight is that the cost of the diet can be used for research purpose, is not only a software, it's also a method. So it requires more technical capabilities to be used, and also to really implement a cost of this diet study and assessment. Maybe it's more appropriate in a slow onset crisis or in a protracted crisis, in a setting where we have access to the area, in a more stable setting, where we think that we would like to develop a CVA for nutrition program, and we can have time and capacities to invest on its development. The NUTVAL is less complex, so it might be quicker to learn how to use it, and it can be very handy to quickly design a top-up CVA assistance transfer value. There are many questions that came up from the Q&A on this. When we already have general food assistance, or when we already have some type of responses that are covering households' food needs in the targeted location, it might be enough just to design a top-up transfer value that take in consideration the needs of these individuals. But please remember that those differences are not set in stone. You might still have contexts in which there is a rapid onset emergency and a cost of the diet study was done recently, so you can use this data very well. And similarly, you can operate in a more stable context and do a similar process to what was done in Nigeria and what was led by Maggie. So really use all the recommendations that were provided today to think of what tool could suit best for you. And for me, there is a very important message that I would like to deliver today. the design of the transfer value on its amount at the end. It's important, yes, but CVA alone, there is a clear evidence from the wider experience of the practitioners. CVA alone will not be enough. It's very important that we understand what are the other barriers that are not economic barriers to undernutrition. And we understand what, in terms of nutritional adequacy, what are the food preferences, what are the food availability. We take in consideration all these elements to set up our social and behavioral change strategies. And we look at all the other barriers to undernutrition to understand what is the intervention that should be combined with CVA to really prevent or reduce child and maternal undernutrition. So I'm going to stop here now, and we are going to go quickly into the Q&A session. We have received so many questions today. We have tried to answer to many of them. I think I'm just going to try to summarize some of the topics, the key topics that were highlighted from you. We have some specific questions on the calculation, the calculation for the individuals. When we have already in place a transfer value for general food assistance, how do we design the transfer value for the individuals? There are more specific questions on the capacities and functionalities of the tools of the NUTVAL, some questions on food list and food preferences, and there are some questions also on the importance of taking in consideration a specific typology of CVA when CVA is used to access to child and maternal nutrition services or child and maternal health services. I wanted to remind you that today we are not going to cover this topic. This is another recurrent objective. We can use a CVA to access to child and maternal health services and nutrition services, but today we choose to focus on nutritional adequacy. So we definitely can explain more on this methodology, but it was not the focus of today's presentation. So I'm gonna ask Diane your help to call some of the questions that are unanswered and some of the hands that are up.
I think the first hand is from Anna that has been raising it for quite a while. Anna, do you want to talk? I think you have permission, or Sanya, can you help me for Anna Godfrey? Anya, can you hear us?
Hello, hi everyone. Yes, I can hear you.
Very well.
My question, of course, someone responded through chat box. I was just to be clear on the kilocalories presented, 2,100 per day, but I got a response that is per individual per day. Thank you, over.
Thank you, Anna. Still looking at the hand first. Anne-Sophie, do you want to, I allow you to talk. Do you want to unmute yourself? Anne-Sophie, can you hear us?
I think she responded in the chat box saying that her question
great.
was answered.
Next one is Diallo, Diallo Amadou. Diallo, vous pouvez passer la question en français si vous préférez.
Oui, bonjour. Bonjour.
Oui, bonjour, nous vous entendons. Est-ce que vous avez une question?
Bonjour, je vous remercie d'abord pour cette présentation. Mais moi, mon problème que je ne maîtrise pas l'anglais, ça c'est un. J'étais obligé d'activer la langue française pour vous suivre un peu. Mais moi, ma question, c'est par rapport aux transferts sociaux, entre les transferts sociaux et transferts dans les cadres de nutrition, surtout dans les contextes de réfugiés. Parce que moi, je travaille avec les réfugiés. Et comme ça, est-ce qu'il y a une différence entre les transferts sociaux dans les contextes de réfugiés et les transferts nutrition dans les contextes de réfugiés? Je ne sais pas si vous avez compris.
Je ne suis pas sûre. Les transferts sociaux et les transferts nutrition. Vous voulez dire les transferts monétaires?
Oui, transferts monétaires, oui.
D'accord, parce qu'en fait, on parle de transfert monétaire pour la nutrition, avec un objectif nutrition. Donc, c'est en fait, ça va être la même chose. Ça va juste dire quand on parle de transfert pour des transferts nutrition, c'est des transferts monétaires pour la nutrition.
Ok.
Peut-être,
Marina, est-ce que tu peux répondre pour
je
les
peux
cas de
essayer
réfugiés?
I can try to share some considerations. Je peux essayer de partager quelques considérations clés quand on travaille avec des réfugiés, des populations qui sont en mouvement. Par rapport aux transferts monétaires qui sont utilisés quand on travaille dans la protection sociale, je pense qu'il est important de considérer que les populations en mouvement ont des besoins multiples. Très souvent, ils ont des besoins liés à tout ce qui est abri, à tout ce qui est hygiène, à tout ce qui est communication, parce qu'il bouge beaucoup. Donc, il est important, si vous voulez regarder un peu s'il y a des safety nets, non? Si je comprends bien votre point, s'il y a des transferts qui sont plus basés sur les systèmes de protection sociale et qui ne prennent pas en compte ces besoins additionnels. Je pense qu'il est important de regarder comment compléter ces besoins. Et s'il est préférable pendant un moment qui est un moment sensible pour les besoins humanitaires, de préférer pour une méthode qui puisse couvrir ces besoins multisectoriels. J'espère que j'ai répondu à la question.
Oui, oui, c'est ça, parce que les programmes là où je travaille, c'est un programme dans la protection sociale. Il fait des transferts sociaux, mais aussi on fait des séances de sensibilisation qu'on appelle de promotion sociale. Ces séances sont basées sur des séances nutritionnelles, l'hygiène et le développement de l'enfant. Et dans ces cas-ci, on voit si on analyse bien la situation, on est en face d'un ménage réfugié qui a beaucoup de besoins. Il a aussi des besoins nutritionnels. Mais l'assistance qu'on donne, il couvre seulement ce qui est de protection sociale. Mais dans l'autre côté, on donne des séances de sensibilisation sur l'hygiène, sur la nutrition et sur le développement de l'enfant. Peut-être qu'on oriente les ménages un peu là où il peut dépenser l'argent qu'il va avoir sur la protection sociale. Peut-être sur la nutrition, sur l'hygiène et le développement de l'enfant.
Merci
en tout cas,
beaucoup.
merci pour votre réponse.
Merci beaucoup. Oui, je voulais, I would like to, n'hésitez pas à nous contacter, on peut vous orienter davantage sur ces méthodes. I would like to give the floor to Andy first. There were a few questions for him. Andy, you have the floor to answer on the NUTVAL.
Thanks. Sorry, what was the specific question, please?
Yes, so there was one question on some specific, does the NUTVAL use the CPI and the LCMS data? And the second question is about the food preferences, I think, of the NUTVAL. NUTVAL doesn't contain most of the food available locally. Will that be a change in the new version? Over to you.
Thank you. Could I just check with the person who asked the question, CPI, are they referring to Consumer Price Index or something else? CPI.
The question was asked by Edmore Mangisi, if he's still online.
Perhaps I could assume that it was Consumer Price Index then. And what the current version does, to be clear, the current version 4 of NUTVAL doesn't actually contain price data. And so the users would then have to construct a separate spreadsheet with the price data and the basket, the food basket, or the food ration that they designed in NUTVAL. What we're working on now with version 5 is to have the price data also included, so prices can be saved along with different food items and also changed. And in that calculation, we would there's also an entry where you can put the expected inflation rate as well. So a CPI or something similar that you might get locally in terms of an estimate of inflation over the forthcoming program period. I'm afraid I'm not quite sure what the second abbreviation was either.
That's fine.
Oh, the Living Conditions Survey. Sure. The actual, no, it doesn't contain that data directly. But yeah, I'm not quite sure how that would or could be incorporated. But it might be something perhaps a bit more suited, or perhaps cost of the diet would be a better tool to use that sort of diet data, or that sort of survey data in, perhaps.
Thank
Okay,
you so
great.
much.
Thanks. And then on the other question, which was about local food. So absolutely, as we pointed out in the comparison section, the databases are much more comprehensive in cost of the diet than they are in NUTVAL. NUTVAL has a much smaller database of food items, focusing primarily on food assistance items that were available in food transfer programs. But in the next version, again, version 5, we will be including quite a lot of additional food items that have been specifically requested by users or organizations who wanted certain items added in. So it will get a bit better in the next version. There will inevitably, I think, still be foods that people will wish to have in there, which aren't in there. But there is currently, and perhaps quite a lot of users may not actually use this function. There's a space where you can enter your own foods and your own nutrient data if you want to include food items which aren't currently in the NUTVAL database, but you want to include them in a calculation. Thank you.
Thank you, Andrew. And there was a question for Damien. Damien, if you want to answer.
Yeah, sure. So regarding the household economy survey, usually what we do when we look at the wealth group, the poorest wealth group, is done during the quiet times, like the peace time when there's no emergency. So usually during this time, people, they don't really use coping mechanism, in the sense that they spend the money they have. And if they use, for example, like in Bangladesh, microcredit, this is considered as part of additional income. So we don't calculate, we don't include coping strategy in the survey. I hope I answered the question.
Thanks, Damien. So there was a question from Tamirat. The question was about donors' interest in funding CVA for nutrition preventive activities in target locations where CVA is already provided for general food assistance. It's a very good question and often a challenge for us. I think it's very important that we use our evidence from our case studies, evidence from the two case studies that were presented today, but also from the other experiences included in the evidence and guidance note, for instance, to show that when CVA is not designed to meet the nutritional requirement, but also to really understand these food preferences, it falls short in meeting the outcomes. So my suggestion would be really try to advocate with donors for having a transfer value that is taking in consideration these fundamental steps. It can be higher, but what really is more important is that it really reflects these food preferences. And this can be done, as I said before, this can be done by adding a top-up and trying pilot. We're in need of more evidence on the use of CVA for nutrition from the humanitarian setting. So I would really encourage you to use these experiences. I think we are running out of time. Yeah, I'm done.
Just saying that we need to move forward. We have 2 minutes left if we want to stay on time. So I let you.
I'm gonna hand over to you, and we're gonna try to answer in the Q&A box.
Okay, next slide, Kate. So this was a couple of questions we had in case we had time. Unfortunately, we don't have, but we would really like to hear from you about the challenge you are facing and especially what you would like to learn more in this upcoming webinar. As I say at the beginning, we will have a webinar specifically on cost of diet. Again, please don't expect to come to this webinar and to be a full cost of diet expert. It's quite complex and it takes at least a few days to understand, but you will be able to know more. So just reach out to us, send us an email, write in the chat box what you want us to cover during this incoming webinar. It will be 90 minutes on November 16. So thank you. Next slide. So I think it's time for us to part. Thank you again for everyone that facilitates this webinar. Thank you to Masoud, Marina, Maggie, Andrew, and Damien. Thank you to Hélène, Carmelo, and Dina that did the translation, and also for Sanya that did a terrific job at organizing everything. Now, if you want to know more also about the Global Nutrition Alliance, please don't hesitate to reach out. Can I have the last slide, Kate, please? And yes, if you want any type of support, it's looking at nutrition in emergency as a global alliance. But as I say, there is this global CVA for nutrition outcome group. So if you want to know about it, don't hesitate to reach out to us. We are welcoming any newcomers, and we can also provide support to countries who could be interested in developing, for example, CVA for nutrition guideline, as it's the case currently in some countries. So there will be a quick survey. Again, please fill it. That helps us to do better next time. And we are all looking forward to see you all on November 16th. So thank you again. And I think that's all.